People like Prince Harry and Evan Rachel Wood have talked about their experiences with EMDR and how it's been effective for some of their traumatic experiences.
And a therapist, Kristen Jacobson.
Hey everyone, I'm Kristen, the anxiety therapist. Today I want to talk about EMDR, which stands for eye movement desensitization and reprocessing. This is a form of psychotherapy that allows you to work through heightened emotions or traumatic experiences. You may have heard about it because I feel like it's been gaining more traction in the therapy world. There have been a lot of articles about it. People like Prince Harry and Evan Rachel Wood have talked about their experiences with EMDR and how it's been effective for some of their traumatic experiences. It's also endorsed by the American Psychological Association, the World Health Organization, and the Department of Defense. It was originally developed to treat post-traumatic stress disorder and anybody who would be considered a trauma survivor. But over time, it's been sort of modified and it's really proven to be effective for just about any mental health condition. So we're talking anxiety, depression, grief, eating disorders, addiction, bipolar disorder can be really effective for any sort of emotional distress. So how does EMDR work? Well, it uses eye movements or other types of bilateral stimulation to help the brain reprocess and consolidate traumatic memories and beliefs. So what does all of that mean? Basically, if you think about what our eyes and our brains do during REM sleep, that's sort of imitated in EMDR. Bilateral stimulation basically just means that you are crossing the midline of the body. So a lot of times that means, your eyes will go back and forth, and that would be the eye movement, using eye movements as bilateral stimulation. Other times we can use butterfly tapping. We're crossing the midline of the body. If you are doing EMDR in person versus virtually, your therapist might use these buzzers or sensors that kind of vibrate back and forth, crossing the midline of the body. And basically what happens is it is allowing the two parts of your brain to come together and reprocess these traumatic experiences and memories. How does it work? Basically, this bilateral stimulation, like I said, it engages both sides of the brain. Generally speaking, the left side of your brain dominates language processing, memory association, and positive emotions, while the right side of your brain dominates visual interpretation, spatial reasoning, and negative emotions. In addition to that, each side of your brain actually controls the opposite side of your body. Bilateral stimulation helps stimulate both sides of your brain so you can make new neural connections and process traumatic memories that may have gotten sort of stuck. Processing trauma oftentimes requires making associations, we have visual information, putting words to our feelings, and working through both positive and negative feelings. And so this bilateral stimulation helps your brain accomplish this task so you can make meaning from what happened and move forward. If you think about a memory that is triggering for you or causes distress, basically what EMDR does is it still allows you to have that memory, but it takes the sting out of it. It's sort of like if your brain is like this supercomputer, but sometimes it gets glitchy. EMDR will kind of debug those glitches by reprogramming the way you process those distressing memories. It's sort of like hitting a refresh button on your mental browser. So it's like rewiring an old circuit. The memory stops being this haunting thing and starts becoming just another story in your book of life, so to speak. And then as you revisit these memories, they start losing their sting. Again, you're not erasing history. You're not removing these memories from your brain. You're just changing the way it makes you feel. So it's kind of like watching a horror movie with the sound off. It's still there, but it feels a lot less scary. And the other great thing about EMDR is that it can be a quicker form of treatment. It doesn't involve rehashing everything that happened during a traumatic event or a series of traumatic events. It's more about letting your brain do the work versus verbally processing through everything. So I know some people have a hard time with trauma therapy if it involves them revisiting those experiences and getting really emotionally dysregulated. So EMDR is very careful to make sure that there are some skills and techniques in place so that that dysregulation doesn't occur. And a lot of people ask about whether EMDR is hypnosis or if it's similar to hypnosis. So I just want to highlight the fact that it is not hypnosis. EMDR uses bilateral stimulation to allow your brain to make new neural connections, whereas hypnosis uses guided relaxation to put you in sort of this more focused state for therapeutic purposes. EMDR has been super effective. I hope that if you are experiencing emotional distress that you will look into it. EMDRIA, EMDRIA, is a big database for EMDR and has a list of providers, so feel free to look somebody up in your area. And then if you reside in Illinois, Michigan, Wisconsin, or Florida, I would be happy to have a consultation to see if I could provide EMDR and whether it would be an effective form of treatment for you. So I hope you found this helpful. Be sure to head on over to my website, catharticspacedcounseling.com, for some additional free resources or to read up a little bit more about EMDR, and I hope you have a great week.